Education is a huge part of what I do as a nephrologist. Yeah. And especially as people come to you who may not even know they even have kidney disease because it's pretty silent. And maybe their primary care doctor picks it up on a blood test. They look at their blood creatinine level and it's abnormal, it's high. And then they refer the patient to us. A lot of people have no idea that this is a problem for them because they may not have any symptoms. So there's a huge amount of education that goes into that first visit, especially since you're trying to help somebody out who may not even know that they need help. There can be some resistance and sometimes some denial in that. There's a really special system of capillaries in the kidneys, and these really specialized capillaries have the job of filtering out the toxins and getting those toxins into the urine through another very complicated system of what are called tubules, these little tiny tubes in the kidneys that eventually put out urine. So it's a pretty complex process of making urine, but eventually that's the end product. I'm extremely excited to come to Pentucket Medical Associates. Yeah, it's a dynamic group, a lot of really enthusiastic physicians who I'm joining, and I think we'll all work very well together. Yeah. I got into medicine, well, I wasn't sure at first what I wanted to do. When I was in college, I did a lot of research at the bench side in chemistry and biochemistry, and my laboratory advisor asked me, do I want to go to graduate school and do more basic science research? And I told her no, I'd rather see patients. It's kind of the combination of science with patient interaction is really what I wanted, because sure, laboratory experiments can vary, but I feel it's the interaction with other people that is really the dynamic process. I mean, every person's different, and everybody comes to you from a different walk of life, a different perspective, and to try to meet them where they come from, I think, is really a challenge and is the rewarding part of medicine. It used to be that some patients would just come to a nephrologist for the first time when they needed dialysis, and that's pretty devastating because there's not a whole lot at that point that you can do other than start dialysis. But now there's a lot more that can be done. So I guess what I would do is to try to provide some reassurance to you that there's a lot that we can do to try to slow down or maybe even treat whatever kidney disease that you have before you need a transplant or before you need to start dialysis. And that it's definitely a two-way process, though, that I can help you, but you have to help you too. So I really try to empower people in that way, avoiding a lot of salt to try to keep your blood pressure down, or just taking your medications, because some medications that have come out can really slow the progression of kidney disease, and not a lot of people know that. So that piece, I think, is really important. And then even more importantly, though, is if you know you have kidney disease, is to make everybody else know that you have kidney disease, because there are a lot of medicines that you could be given that would damage your kidneys or be very dangerous to you at the doses that we normally prescribe them if your kidneys are working normally and metabolizing drugs. So if you know it and you can tell other people about it, then hopefully those mistakes won't be made. In urgent situations, a lot of times in the hospital, nephrologists will be called for patients whose kidneys aren't working, and the decision will be made, does that person need to start dialysis or not? And that can be a tough call. It's not black and white all the time. So it's kind of a decision that's made by the nephrologist, but also with the patient and sometimes with their families too. In this country and in most developed countries, diabetes is the leading cause of kidney failure over the long haul, and high blood pressure is also a leading cause too. So it's very common. High blood pressure can put stress on the blood vessels of the kidneys and cause those blood vessels to get really thickened, and then they can't do their job as far as filtering out the toxins and helping with the kidney function over the long haul. The kidneys help to cleanse the blood from toxins, and it also helps to balance your body's electrolytes, your sodium and your potassium, and also your bones. It helps to balance the bone mineral metabolism, like your calcium and phosphorus. And something else that not a lot of people know is that the kidneys also help to regulate your blood count, because it releases hormone that helps your bone marrow to produce red blood cells. So if your kidneys are failing or they're not working 100%, then all of these systems can become a little out of whack. And it's real important to have an expert follow you for these complications of your kidney disease, because they're pretty complicated. Nephrology is a great field. It incorporates a lot of chemistry principles, which I find fascinating. But for me, it's really the patients that drew me to it as a field, especially the dialysis patients who, I'll see several times a month, and the continuity of care there is excellent. And they're just a great group of people who are going through a trying time. So if I can help them in any way, I find that to be really rewarding.